Thank you for joining, everybody, for this seminar that we're organizing together with Law Enforcement Action Partnership Europe. Very excited that you're all here and also in the live stream. Just a little introduction of who I am. I'm indeed an academic. I'm a postdoc researcher at the moment at Tampere University, more focusing on cannabis research, bit of a community organizer and a board member of the Finnish Association for Humane Drug Policy. I'm also a representative of our association in the Civil Society Forum on Drugs, which is an expert group consulting the European Commission. And I wanted to mention something that I don't usually mention, but because of the theme, I'm also a military police sergeant in the Finnish Armed Forces. So I have a bit of a background in that, but I'm not saying I'm in any way an expert in policing. I do say that I'm an expert on drugs, and that's what I'm going to focus on, but just a few words of introduction of our association. Our association was founded in 2001, so it has a quite long history. It was inspired by discussions on something called SFNet, which was like a pre-social media online site. And the aims of our association are to reduce harms caused by the use of drugs to the individual and to the society, to enhance the development of preventive drug use work and treatment opportunities for drug use disorders, and to promote an open environment for discussion on drug policy, mainly domestically, but also globally, as we are here. We strive to these goals by actively participating in the social debate on drug policy and by taking an open-minded stance on current issues. And those are our social media sites, so where you can follow us more. And when we talk about drugs, we talk about all of these and more. This drugs wheel, which I also translated into Finnish, kind of gives a nice overview of not all of the different substances when we talk about drugs, but it kind of gives an overview of different groups. There are stimulants like cocaine and amphetamine, but also methylphenidate, for instance, which is mostly used for attention deficit hyperactivity disorder, but also for instance, cognitive enhancement by students, which was my PhD topic. There's pathogens like MDMA, or ecstasy as it's called, which is also used for treating post-traumatic stress disorder. Probably going to get an FDA approval either this year or next year for that indication. And of course, PTSD is something that's very prevalent, of course, also in law enforcement and military and such working groups. The psychedelics, Finland has started its first clinical trial on psychedelics, psilocybin-assisted psychotherapy for alcohol use disorder, sponsored by a Canadian company, and the first clinical site has started their work. There's dissociatives, for instance, ketamine, mostly used as an anesthetic, but also currently been investigated for depression, for instance, and suicidal ideation. Depressants like alcohol, which then the psychedelics are investigated to treat, and of course in Finland it's quite prevalent, the use of it, and has, of course, quite interesting government monopoly in its control and sales. Opioids and cannabinoids are, of course, also part of this discussion. And the outer ring is these more older, established drugs, but then the inner circle is these more new psychoactive substances, or muuntohuumeet in Finnish. And I think on European level, for almost a decade now, EMCDDA, or the European Monitoring Center for Drugs and Drug Addiction, together with Europol, I think they detect about 2 new substances per week. So this kind of like mixes this whole discussion when we talk about drugs. It means all of these and more. And of course, we probably all know that drugs can have harms, and these studies kind of show a bit of the relationship that they have to each other. And most of these studies do show that alcohol is usually the one that causes most harm to the user and to society in kind of many ways. These studies are quite specific in a way that the one on the blue and red is more UK focused, and the other one is more European focused. And in the Finnish context, I think this would be very different because we don't really have the alcohol is first and then it's heroin, but we don't really have street heroin in Finland. At the end of the list, there's buprenorphine, which I think in the Finnish context would kind of replace heroin in terms of what all the harms it might cause, because indeed it's the most prevalent opioid that people use. I myself, as a researcher, I'm not that interested in harms, I have to say. I recognize that they exist, but I would be more interested in doing a multi-criteria decision analysis of drugs and the benefits they cause to users and others. And that's a discussion that's often not really spoken about. In terms of the Finnish context, here's some figures about the prevalence of drug use, and cannabis has become kind of on a league of its own. Almost every fourth of Finns have at least tried cannabis once in their lifetime. The second most prevalent type of drugs are medications, so mainly sleeping pills, tranquilizers, or opioids, or painkillers. So that also kind of mixes this drug versus medicine discussion. Legally they are separate, but in actual practice they can be both used for intoxication or for other means. There's some numbers about costs in the other slide, and in total Finland spent in 2016 109 million to social care and about 47 million to health care, so approximately 150 plus million on that, and then 99 million for kind of security and safety, and 64 million to kind of judicial system and imprisonment. So that's a bit higher than the social and welfare care. So we've had this sort of dual track policy where we do offer support like needle exchange and that kind of stuff, but we still consider drug use as a criminal activity, and this kind of dual track of support and punish is something that I think is quite ineffective. So drug policy in recent years has kind of moved, at least with cannabis, to this kind of middle ground of strict legal regulation, because a lot of countries have realized that this unregulated criminal market is causing a lot of social and health harms. And at the same time, alcohol and tobacco policy has also moved from a more unregulated legal market toward this sort of middle ground. But we can see that at both ends there's a lot of social and health harms. So if countries do move and have moved towards more legal regulation, it's good to keep in mind that if it's this kind of very capitalistic, everything goes, that it will also cause harm. So it's good to keep that in mind as well. I'm very excited about today's program. We have a great lineup of speakers, both internationally and domestically, and we'll get to that in a minute. I would like to really much thank you, all of you being here, and all the speakers already, and I hope we have a very good discussion and move things forward. Thank you very much.